Hello, I would like to introduce Berit Lindahl, who is working at Borås University. Welcome to Acoustic Bulletin. What is the reason for you being here today?
I'm an invited guest here because I have cooperation with Professor Kerstin Persson Way, and we have cooperation in a research program dealing with the sound environment in an ICU.
There's a cooperation between Borås University College and Sahlgrenska Academy of Gothenburg University. Is that correct?
Yes, it is. And I work together with Professor Ingegerd Bergbom at Sahlgrenska University, and together we are the two projects leader for a cooperation program which has the title "A Healing Environment in an ICU."
In ICUs. And it's 3 PhD studies that's going to be performed in that research program?
Yes, it is. And one of these PhD projects has a sound perspective or a noise perspective, you may say.
We are partly involved as Ecophone. What is going to happen in that project? When is it starting, and what are the main things about the project?
Actually, it has already started. As we are doing the refurbishment of one ICU patient room, and we are going to design it and decorate it based on the knowledge from evidence-based design. And that means that we are taking a holistic perspective, you may say, about how to decorate the room and how to make it good and as working as a healing environment concerning, for example, sounds and noise, because there are a lot of technological equipment there, and we know that these sounds may disturb the patient as well as the staff and also the patients next of kin.
Yeah. Already a lot of research has been performed within ICU premises in relation to evidence-based design. Is that correct?
There aren't so many studies. We have maybe Professor Ulrich, Roger Ulrich, he's well known within the field, but most studies have been performed in other caring environments, such as post-operative care and operation theaters and the basic units, surgical wards, and so forth.
What is specific about ICU, which makes it such a complex environment?
I think it has to do with, of course, with the patient's health or loss of health, because the patient are critically ill. That's the basic for being there, but it has to do with the equipment, and it has to do with complex medical care, and there are also a lot of people working around the patient and around the patient.
Must be a rather stressful environment for staff as well.
Yeah, and the patient are primary care. All patients, as they are have severe illness, they are being treated in the bed.
Yeah.
So, and around the bed you have a lot of technological equipment, and then you have a lot of people working around the patients, and there is also not a big difference between day and night, for example, things like that. So it's a very complex situation and a complex environment that may itself cause illness.
Why does Borås University College pay so much attention to this? Or is it all university hospitals doing that?
No, I think that is a new idea, because there has been a lot of research in intensive care, especially in the Nordic countries.
Yeah.
And the research there has mainly have had a patient focus, and we know from patients' narratives about their time being treated in ICUs, and they have told about unreal experiences. And we also know from research that after when you have recovered and you come home, you have sometimes a lot of problems to carry on, because you have dreams, you are still afraid of things, you don't want to go to a movie, for example, if the movie is scary, or there could be other things as well that you don't like to do them because they make you feel unsure and feel unwell and unsure about things. And sometimes you also have a lot of medical symptoms left. For example, pain, wounds that hasn't healed. And so the care period, you may say, hasn't stopped. Even if you are at home, because you carry on thinking about the time and what has happened in the ICU. So we know from research that people that has been treated a long time in ICUs, there are difficulties for them to get back to work. So if we can help people when they are treated at a ICU, and maybe the environment is one aspect that could bring a feeling of well-being.
Could make the stay better when they are there, but also when they come home.
But afterwards as well.
And we know that, let's say, views of nature can help, for example, that working intensively with the sound environment could make a difference. Art, for example, daylight. Those are all aspects that are going to be taken into account.
Exactly, and we have already made some interviews with the patients where they tell us about their recallings about sounds. And some sounds, I think we may call them unnecessary. One example was a woman. She told me about happenings that happened several times during a day or during 24 hours, and that was a special sound in her ears and someone putting a pen or something in her ears, and then she heard a sound and she thought that maybe they were giving her electrical impulses. And she was very afraid of that sound. And that sound was, she was told afterwards, when she was well enough to ask about it. It was the staff taking controlling the temperature. And when I thought about that story, my reflection was, why do we need to have a sound when the temperature is finished? Because you can read that on the display. You can read the figures there, so it's totally unnecessary to have a sound saying, well, it's clear.
Okay, that sounds very interesting. I think we round up here. I would like to thank you for the interview. One bonus question we have. Who do you think will win the World Championships in football? Who's your favorite?
Maybe Brazil, but it should be funny if Argentina take the championship.
Thank you very much.